The World Health Organization has declared Mpox a global health emergency. This announcement marks a critical moment in the global health landscape, highlighting the severity of the situation. This is a serious alert. The declaration underscores the urgent need for coordinated international efforts to combat the spread of the virus. It signals an urgent need for international action. Countries around the world must now mobilize resources and expertise to address this escalating crisis. The declaration came after a rapid increase in Mpox cases. Health officials have been closely monitoring the situation, noting a troubling rise in infections. The outbreak is concentrated in Africa. Communities there are facing significant challenges, with healthcare systems under immense pressure. It poses a significant threat to global health. The potential for the virus to spread beyond Africa is a major concern for health authorities worldwide. The decision to declare an emergency wasn't taken lightly. Extensive deliberations and consultations with experts preceded this announcement. The WHO uses this tool sparingly. Such declarations are reserved for the most serious health threats, ensuring that global attention is focused where it is most needed. It is reserved for the most serious health threats. The global community must now come together to support affected regions and prevent further spread of the virus. Mpox is a viral disease that has been causing significant concern among health professionals. It is known for its rapid transmission and severe symptoms, which can include fever, rash, and swollen lymph nodes. The virus is spreading rapidly in Central and West Africa, affecting numerous communities and overwhelming local healthcare systems. The Democratic Republic of Congo is particularly hard hit, with the capital city of Kinshasa seeing a significant number of cases. Thousands of cases have been reported in the DRC, putting immense pressure on hospitals and clinics that are already struggling with limited resources. Hundreds of people have died from the disease there, leading to widespread mourning and fear among the population. The outbreak is not limited to the DRC. Neighboring countries are also reporting cases, raising alarms across the continent. It has spread to at least 13 African countries, including regions that have never experienced Mpox outbreaks before. This includes countries that have not seen Mpox outbreaks before. This is concerning as it indicates the virus is adapting and finding new ways to spread. It suggests the virus is becoming more widespread, and international health organizations are now working together to contain the outbreak and prevent further spread. The WHO is calling for international support. They need help to contain the outbreak. Vaccines are a key part of the response. Treatments for those infected are also essential. There are concerns about vaccine supply. There may not be enough to meet the need. This is a problem that needs to be addressed quickly. Section 4. The need for vaccines and treatments. Vaccines are crucial for preventing Mpox. They work by stimulating the immune system to recognize and fight the virus if exposed. They can slow the spread of the virus, protecting not just the vaccinated individuals, but also the community at large through herd immunity. Treatments are needed for people who get sick. These treatments can range from antiviral medications to supportive care, depending on the severity of the illness. They can help people recover and prevent death. Early intervention with effective treatments can significantly improve outcomes for patients. The world needs to increase production of vaccines and treatments. This requires investment in research and development, as well as scaling up manufacturing capabilities. We need to make sure they are available to everyone who needs them. Equitable distribution is essential to ensure that no one is left behind, regardless of their location or economic status. This includes people in Africa. Access to vaccines and treatments in rural and underserved areas is critical to controlling the spread of Mpox globally. Section 5. Africa CDC responds to the crisis. The Africa CDC is taking action. They have declared Mpox a public health emergency. This is a strong signal. It shows they are taking the outbreak very seriously. The Africa CDC is working with countries to strengthen their response. This includes improving surveillance, testing, and contact tracing. They are also working to raise awareness about Mpox.